Hello, everyone. My name is David Miguel.
Hello, my name is Durando Gadillo.
Hello, my name is Donald Wake.
I'm Christopher Schatz, and we are the members of the Jaeger Group. For this final speech project, we've decided to do an informative speech on mental illness. Now, each member of our group has selected a different mental illness and is going to be talking to you about the symptoms, what the mental illness is, and the treatment options that are available. We hope that you take the information that is given to you so you can maybe help recognize it in other people and see the importance of why mental illnesses are such a big disease and why they need to be taken seriously.
Today I'm going to be talking about the mental disorder ADHD. ADHD is a disorder that causes someone to be unable to focus for long periods of time or with multiple tasks at hand. This disorder is often found mostly with children, but it does carry through to adulthood. It also can be found in adults who were never tested as children. Some symptoms that could give you clues to if you have this disorder or you may know someone who has this disorder is zoning out in the middle of conversations or during an event or anything that they may be doing. If someone's not able to focus or their attention is wandering, they struggle to accomplish even simple tasks, and they have tendencies to miss even little details as far as work or things around the house and stuff like that. Some facts about this disorder are a person with ADD or ADHD is actually 6 times more likely to have another psychiatric or learning disorder than most people. Usually ADHD overlaps with another disorder. I guess you can say it's kind of a disorder that feeds off of something else. There's some physical and mental health problems. The symptoms of ADHD can contribute to a variety of health problems, including compulsive eating, substance abuse, anxiety, chronic stress, tension, low self-esteem. You may also come across neglecting important checkups or skipping doctor appointments, ignoring medical instructions, or forgetting to take medications. In the workplace or finances, adults with ADHD often experience career difficulties, feel a strong sense of underachievement. They may have trouble keeping track of their job or following corporate rules. They may miss deadlines or meetings. They may just show up at work ready for the 9 to 5 routine and get out as quickly as possible. With their finances, people may struggle to pay bills. They may have unpaid bills, a lot of debt, lost paperwork. They may be caught up in late fees, or they could get impulsive spending habits that's actually bad for their finances. In relationship perspective, people who have ADHD or ADHD-like tendencies, it can put strain on a relationship with family, loved ones, anyone you have a relationship, whether it's personal or at work. Things may annoy you easier, or you may not be able to tolerate certain things. You may not be able to stay organized with the relationship or listen more closely to your significant other or family member. Some ways you can actually treat yourself or get the help you need. For yourself, you can exercise and eat healthier and try and train your brain and your body to accept what's going on, and you can get more sleep. if you sleep less, you may aggravate your symptoms. You can also practice better time management and set yourself on a routine that you know will help you out. If you have symptoms where you can't focus as much, well, maybe you should set little breaks in between the activities that you're doing. Some other ways you can get help is you can see counselors for behavior coaching, or you can go see a therapist to do one-on-one counseling. You can see education counselors if you're having troubles in your work, if you're a student. And also you can see a physician and maybe get some medication to help you stay focused more.
We all get a little nervous sometimes when meeting new people, speaking in public, or sometimes for no reason at all as we go throughout the day. However, some people suffer from social phobia, which is a strong fear of being judged by others and embarrassed during social encounters. Some of us get these fears moments before the event we are to attend or while we are on our way. But people who suffer from social phobia worry and dwell on these things weeks in advance of the actual event. Many people affected by social phobia are well aware of their fears and recognize them as irrational, but still struggle to control their fears. What we do know about social phobia is that it is sometimes hereditary and affects about 15 million adults in America. As I stated before, symptoms of social phobia are obsessive and irrational fears of social outings, being judged by others, or embarrassed in front of a crowd. Social phobia could also lead to insomnia, as people will often stay up at night dwelling on what may happen. Some people will also go days without eating since the fear can consume them and make them sick. One treatment option for social phobia is a form of psychotherapy called cognitive behavior therapy. Cognitive behavior therapy teaches people different ways of thinking, behaving, and reacting to situations which help him or her feel less anxious. A second treatment option is to use anti-anxiety medication or antidepressant medication.
Although many people have moments of sadness, these feelings generally pass quickly. However, when these feelings interfere with your life and last more than a few days, it is most likely you are suffering from depression. According to the National Institute of Mental Health, there are several types of depressive disorders that range from major depression to minor depression. Major depression can be disabling and prevents a person from functioning normally. This form of depression can interfere with a person's ability to work, sleep, study, eat, and enjoy once pleasurable activities. Minor depression is characterized by having similar symptoms for 2 weeks or longer that do not meet the full criteria of major depression. Although symptoms of depression can vary greatly from one individual to another, some of the common signs are fatigue, irritability, restlessness, difficulty concentrating, changing in eating habits, or thoughts of suicide. If you notice any of these symptoms in yourself or others around you, there are multiple types of treatments out there. Some of the treatment options include medication like Prozac, Zoloft, or Cymbalta. There are also several types of psychotherapy, such as cognitive behavior therapy, CBT, or interpersonal therapy, IPT, which are both effective in treating depression. Or if both of those don't work for you, there is one more type of therapy, and that's electroconvulsive therapy, ECT, also known as shock therapy.
Anxiety. Anxiety is a normal emotion everybody as human beings feels. However though, anxiety disorder is something that can be so crippling because of the fear and worry is constant and overwhelming. Now most people experience a little anxiety here and there throughout the day, whether it be with money, work issues, or social issues that have come up. But the difference is between regular anxiety and actual anxiety disorder is the constantness of the anxiety. Most people are able to shake anxiety after a short period of time, but people with anxiety disorder have a hard time shaking that feeling. It could sometimes last for hours, and some people it may last for days. You know, you may go to bed thinking you'll wake up the next morning and everything will be fine, but you start worrying as soon as you wake up about something that you've been worrying about for the past couple of days. There are several recognized types of anxiety disorder. Some of those are panic disorder, obsessive compulsive disorder, better known as OCD, post-traumatic stress disorder, PTSD, which is most commonly found in soldiers returning from war zone and has recently been taken more seriously than it has been in the past. And also generalized anxiety disorder, or GAD, which most people don't know, but I actually am diagnosed with generalized anxiety disorder. Some of the symptoms that most people can find in people with an anxiety disorder is the obvious feeling of panic, fear, and uneasiness. And a common symptom in OCD is uncontrollable obsessive thoughts. Repeated thoughts of flashback or traumatic experiences are common in people with PTSD. Nightmares as well. In OCD, a lot of people will experience ritualistic behaviors, such as repeatedly washing of hands or constantly counting to a certain number, and they won't be able to stop until they reach that plateau of what they feel comfortable with. A lot of people with anxiety disorder have trouble sleeping. The inability to stay calm and be still for periods of time. They usually are restless and need to be constantly moving around. Some other symptoms are numbness and tingling in the hands and feet, nausea, and also muscle tension. These are some of the most common symptoms that most of you will look at and say, oh, there's nothing wrong, I'm just, a little stressed out right now. But one thing you need to look out for is repeatedness of these symptoms, because if they do continue for extended periods of time, then they may turn into something more serious. Now, some of the treatment options that are available for people with anxiety disorder are medication. Now, most times you will need to go see a licensed psychiatrist who will evaluate you to see if medication is the right step to take to help stabilize anxiety disorder, which currently I personally am on. There are also other treatment options where just going to see a therapist will help you overcome anxiety disorder. And for most people, that'll help a lot, because it allows you to speak to somebody else and get off your chest, which you may not be able to speak to other people about. Anxiety disorder is a serious mental illness, and as you have listened in all the other speeches, all of the mental illnesses we have talked about are very serious and should be not taken lightly, and they should be observed and treated properly by the proper medical professionals. And I hope you enjoyed watching this speech and you learned from all the other members the importance of mental illness and the crippling effects it can have on the people that it is affecting. And we hope you can now recognize some of those symptoms and maybe help people take that first step into getting treated.